Welcome everyone to the presentation on preparing for the MMI at U Alberta. And in general, today we're focused on MMI preparation and the interview day. Now, the Bright Doctor as an organization, we have webinars on other parts of the admissions process. If you ever need anything, feel free to send us an email and we'll get it to you. Now, a little bit about me. I'm Kevin. I'm your presenter today. I've been accepted to both Canadian and US medical schools. I've applied 2 cycles. And the second time I applied, I got 9 interviews, 4 in Canada, 5 in the US, MMIs across different provinces, different states. So I've seen every kind of MMI there is to see. And right now I'm at the Mayo Clinic. The Mayo Clinic is the #1 hospital on the face of the planet. If you have any questions about international admissions, maybe you want to apply to the US or something, you can feel free to ask me that in the Q&A at the end as well. Okay, so let's look. What is the focus of today's presentation? It's the difference between great answers and extraordinary answers. Now, this entire presentation is built on that premise, and you'll see what I mean real soon. You know the format of your interview, so I'm not going to bore you with this, right? It's in your emails, so I'm not going to bore you with that. Now, what's the first thing you need to do when you're preparing for your U Alberta interview? Okay, and one of the first things is start getting acquainted with health topics, popular health ethical questions, and policy considerations that are relevant in Alberta, maybe in locally, right, where the university is based, and across in Canada and even in the world. So look into the opioid epidemic, look into homelessness, look into barriers to care, rural health care, medical assistance dying. This is a great list. And again, these slides will be sent to you, so you don't have to write it down. And not only do you need to have an understanding of these facts, right? Not only understand, okay, medical assistance in dying in 2021, Canada expanded laws to include people who don't just suffer from terminal illnesses. Now it's like maybe people with mental illnesses can be included as well to receive medical assistance dying. Not only do you have to know facts, but you have to be able to deliver an expert opinion on these facts or on these topics, right? Because they're going to ask you a question, and it's not about, okay, who memorized Wikipedia the best, who memorized CBC Health the best. It's who can give a convincing, compelling argument that is both well-balanced and cohesive. And that's where you're going to stand out. Now, here's the thing. Like I told you at the beginning of the presentation, I interviewed 2 cycles. And the first cycle, I got in nowhere. I got interviews at McMaster and Ottawa in Ontario. And the second cycle, I got into many schools, US and Canada. And I'm at a top school in the US. So what was the difference? The difference was the first cycle that I applied, I took this list of healthcare relevant hot topics. And not only did I have good knowledge about them, but I would also have expert opinions about them. So what was the issue? The issue was I would go into a medical school interview and they'd ask me a question like this. What's your opinion on cancel culture? Right? I've been asked that several times across both Canadian and US interviews, MMIs, panels, doesn't matter. And I'll be like, man, cancel culture. I just spent the last 3 months studying like organ donation. And they're asking me about cancel culture. They're asking me about the wealth gap. I had an interview where they showed me a picture of the world with the wealth concentrations across different places, like the US wealth concentration. And they just asked me, okay, interpret this graph. Like, what do you think about it? You could get asked questions about energy, the Albertan economy, homelessness, housing in Alberta. There's rising houses, vacancy tax, climate change. That's huge, right? You could ask about like recent bills, public versus private schools. And this is the thing. These are things that originally the first cycle I applied and interviewed, I would be like, man, what does this have to do with medical school, right? But when something affects everybody, like cancel culture, like the wealth gap, the thing is, it becomes a matter of public health. And public health is a huge theme in these interviews. So take this list. The second time around, I would go, to this extensive list and understand not only, everything healthcare, but everything beyond that too. And that really helped me provide very strong answers. And, you can get asked funky questions. Here's an example from an interview. Is war good or bad, right? How would you have an answer to that if you just spent the last 2 months going on like healthydebate.ca or cbchealth.ca and reading about, vaccine ethics, right? Is war good or bad? So you got to know, you got to have answers to broader questions. Now, I think the best way to learn is always through practice. So let's do a practice question together. All right. So if everyone can see my page, let's read this. Imagine you're a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? I want y'all to take 10 seconds to think about how you would answer this, okay? Now let's go over an answer. I would conduct a comprehensive assessment of the patient's pain. So this can mean you're going to look at the patient's, when the pain start. What does it feel like? 1 to 10? Does it radiate? Is it temporal? Does it come back at night? All those questions you could ask, whatever. Then you could say, I would have open conversations with the patient about their experience with the pain and their treatment history. Cool. If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means I'd regularly review it and adjust as needed. And lastly, you could give a conclusion. So I want someone in the chat, tell me, either unmute yourselves or put in the chat, do you think this is a good answer to this question? So this great answer, the thing is, I think it's a good answer, and it probably is. This is a good answer to this question. It's a very mature answer. It's something, if I told you right now, a clinician, right, a physician said this answer, would you really doubt me? You wouldn't. Okay, this is something a doctor could actually say. You're fine with that. But here's the thing. That's the sort of answer I would have given the first time I interviewed. All right. And the second time I interviewed, where I got into many schools across US and Canada, here's the sort of answer I would have given. So imagine we say the exact same thing that we said right here. But then we say, I could first explore a multidisciplinary approach to treating pain. For instance, physiotherapy, lifestyle modifications, exercise, or diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. Okay? And then what if we go even farther? What if we make connections to the opioid crisis? Every metropolitan center across Canada, every major metropolitan center is dealing with an opioid crisis. And it's not only like the big cities. I mean, the Northern Territories, everywhere is dealing with this opioid crisis. You could relate it exactly to Alberta and what's being faced in Alberta. What if you also talked about things like sickle cell disease and racism with respect to opioids? So, for example, Black individuals have a lot of times a higher prevalence of sickle cell disease just because the sickle cell trait confers resistance to malaria, especially in Africa. So imagine you have a young Black individual coming into the emergency room and they're in pain, right? Because they've not been diagnosed with sickle cell disease, and they're in pain. They need pain medications, and then the ER doc might be like, "Oh, this person's just looking for some opioids." So there's racism with respect to that, and you can look into those stereotypes. You could discuss specific medical cases that are relevant to Canada or Alberta. You could briefly talk about the science of opioid addiction. So I know a lot of y'all have taken cellular biology. Maybe you can talk about reuptake, right? Norepinephrine and all these different things, serotonin that go on with opioid addiction. And I wouldn't make that the main point of your argument, right? You want to actually give an answer, but you could briefly mention this as well. What if you mention your knowledge of things like naloxone training? So Narcan or naloxone is a treatment. It's kind of antidote to this opioid stuff. And a lot of times people do street medicine programs. They'll be like volunteering and helping administer naloxone, or maybe you're trained in naloxone. These are brilliant things that you could add and take this great answer to an extraordinary answer. Okay? And by the way, all the questions and answers we're using today come from our website, thebrightdoctor.com. This one in particular comes from our opioid crisis mini question bank. So you can see, and we also have ideas to go beyond and red flags to avoid for every question. For example, you could have also said, advocate for the use of a state or provincial prescription drug monitoring program to track opioid prescriptions. So every province in Canada has this. They track which physicians are prescribing opioids and how much. It's called stewardship. So they want to make sure, this person's not administering too much, because it's going to increase the risk of dependence. Now, here's the question. Why do you need to give those extraordinary answers? Why can't you just give, the sort of answer I would have given my first year, which is like mature, hits all the points. It's a solid answer. And here's what it comes down to. There are what? Hundreds of people, 500, 600 people interviewing for the medical school. And what? 200 get a seat. Like 33%, 40, if you consider like waitlist movement, maybe 40%. The thing is, everyone who has an interview today is deserving of that seat. Everyone has stellar scores, whether it's your GPA, your MCAT scores. Y'all did things like the Casper. Your extracurriculars are at the level where you're getting interviews at Canadian medical schools. So the thing is, everyone is at the top of their game. So you need to find a way to stand out. All right. And for me, standing out and becoming, these two people that end up getting accepted was you can't be saying the same thing as everybody else. That's the core thesis. So I like this image a lot. It's these people who are pushing a block and they're going, towards their successful interview. And maybe they're looking back. They think this guy's an idiot. What's he doing staying all the way back? And he's maybe looking ahead, he or she. And then, these people look ahead. So the first time I interviewed with Canadian medical schools, this would be me. These people would be me. I'd go on healthydebate.ca, CBC Health. I'd listen to CMAJ, the CMAJ podcast, Canadian Medical something Journal. I'd listen to White Coat Black Art. I'd read Doing Right. I'd read books, right? You're interviewing with someone face to face, and I'd spend like 2 weeks reading a book. These aren't bad resources. In fact, a lot of them I haven't touched, or I've only like I've read some of them. And the thing is, I'm not saying these are bad resources. They're very great, in fact. But if everybody's doing the same thing, if everybody's reading the same articles you are, everyone's reading the same, beneficence, non-maleficence, justice, all these principles, and everyone's using the same mindset of thinking, how are you going to stand out? And I'll tell you what I did to become this person in the purple that made me stand out in my interviews, okay? Because standing out, you can leave it to chance, right? 40% of people might get in after the interview stage. You can leave it to chance, and then it becomes kind of who's the best communicator. But I didn't like those odds, especially because it was my second cycle, and a lot of people, I was grateful. A lot of people on the third, fourth, fifth cycle. So I wasn't down to leave it to chance, and I wanted to stand out in a reassuring way. And after I got into my schools, I really distilled the ways you can stand out to these 5 pillars. And this might be the most important slide, in the presentation. The 5 ways that you can stand out in your MMI answers, in your panel answers, is you're either going to address more perspectives than other people. You're going to offer more alternative solutions, right? Creative solutions, or maybe how you can avoid certain issues in the future. You're a better speaker. You're more personable. You have a more organized answer, less ums and ahs when you're talking, and you can look at the camera and speak with confidence. So for instance, if I told you right now that the average length of a giraffe's neck is 18 feet, you believe me, because I can look at a camera and speak with confidence, even though I fully made that up. That is very key. You make connections either to your personal life. So for example, the opioid addiction question, it could have been, I've done a naloxone training or whatnot, to your future career, or you maybe demonstrate specific domain knowledge. Like again, with the opioid question, you could have talked about opioid science, opioid addiction science. And lastly, you explain why. I have a lot of colleagues who interviewed and didn't get in. They'd have the coolest solutions to things, right? How should we address, this public health issue? And they'd be like, man, let's make an app. Let's use virtual reality to train people, right? But they would never explain why. Why do you need to use virtual reality as opposed to, something else? Why do we need an app? Why can't we just use, the newspaper or something? They wouldn't explain why. And that really docks them in their point. So always explain why you're doing things, because it reflects your values, and especially those CanMeds roles in your answers. And now I have this picture. Everybody knows this guy or gal in your class, a smart aleck. This is the person that thinks they know everything, and they speak really condescendingly to people, okay? But the thing is, smart alecks, more often than not, they can look at a camera and speak with confidence. And I hate to say it, a lot of the times they make it pretty far. They make it pretty far in interviews and the whole process just for this fact. And other people who have very well-researched answers, they have great ideas in their head, they won't get in because they're looking at a camera, they get flustered, they don't have an organized answer, and they don't speak with confidence. Now, should you speak for the full time? I mean, typically no, but when it's like an asynchronous interview, yes. But all right, so for your MMIs, I mean, there's follow-up questions. So the thing is, I wouldn't be rambling for like the whole time because in my personal experience, a lot of the times, if you miss something in your answer, they're gonna ask you, okay, all right, you raised this point, but what about this? So they kind of want to they're even gonna want to help you in a certain way. They will probe you on stuff you might have missed. In my personal experience, okay, um, and that's gonna help you get points. Now, if you're gonna ramble for X minutes straight, then you're gonna lose points that you could have gained. And should you go in depth or broad? So should you talk about like 20 different perspectives at a shallow level, or maybe just one thing very deeply? And my personal opinion is I always discuss one or two topics very deeply, but I always acknowledge other perspectives either beforehand or towards the end. Okay, like this is I think we should do this, although I acknowledge that these other perspectives do exist. That's usually how I go at these things. Again, you can ask me specifics in the Q&A. All right, now let's go to a question that hits close to home. Given the recent initiatives to stabilize and evolve primary healthcare in Alberta, how would you propose to further enhance accessibility to healthcare services in rural and remote areas? Okay, so I'll let y'all think 10 to 20 seconds. What would you answer for this question? So let's look at this answer. So it's really a rural health question. I mean, specific to Alberta, what should we do to address the social determinants of health of rural patients? So I'm going to skip the main idea part. Let's look at this. I'm excited about the potential to further improve healthcare accessibility in rural and remote areas of Alberta, considering the recent initiatives to stabilize and enhance primary healthcare. Okay, boom. Alberta's healthcare system is actively evolving with the Modernizing Alberta's Primary Healthcare System MAPS initiative and a $200 million investment to strengthen primary healthcare, particularly benefiting Indigenous communities. Amazing. In these answers, and you can see how it's structured, I usually like to talk about my knowledge first. Here's my knowledge of the situation, and then get into answering the question. Because this shows that, you understand the issue, you understand what's going on. You're not some person who just turn on the camera and you're being asked questions. No, you've been in the Alberta healthcare system, you've been volunteering, you understand these populations who are vulnerable and have certain healthcare needs, and you know what's going on to benefit them right now. Okay. The first step to enhance accessibility in rural areas is leveraging technology. Telehealth has emerged as a vital tool during the pandemic, and its continued expansion could significantly benefit remote communities. By offering virtual consultations and remote monitoring, healthcare providers can overcome geographical barriers, ensuring timely and efficient care. This approach not only reduces travel time for patients, but also allows for better chronic disease management and follow-up care. Amazing. So right off the bat, we get to, here's a great solution that can help. Another critical aspect is workforce distribution. The current initiatives include a focus on supporting family doctors and nurse practitioners, with each provider eligible for up to $10K a year to help more people. This funding can be strategically used to incentivize healthcare professionals to practice in underserved rural areas. Furthermore, integrating nurse practitioners and physician assistants into rural healthcare teams can expand the scope of accessible services, ensuring that residents receive comprehensive care. Again, a lot of people, when they see this question, they think, okay, rural healthcare, boom, telehealth. Oh, I have the magic answer. They're going to love this. They're looking for the answer, telehealth. But they don't think, I mean, there are many ways you could address this problem. So it's saying right here, what if we give more funding to persuade people, hey, come to these rural areas, we'll pay you more? Or what if we give nurse practitioners, physician assistants, things that require less schooling, we give them like additional autonomy to come into these areas and have a larger scope of services that they can provide to ensure our rural communities get the healthcare they need. Now look where so this is a great answer, by the way. These first two paragraphs, I mean, this is already better than what 50% of people are saying. Let's go here. Let's see what else we say. Collaboration between healthcare providers and communities, especially Indigenous communities, is also essential. The formation of an Indigenous health division within Alberta Health and a $20 million fund for Indigenous communities to develop their own primary healthcare services are commendable steps. These initiatives must be community-driven, respecting the unique cultural and health needs of each community. Building trust and understanding cultural sensitivities are key to successful healthcare delivery in these areas. So we're going, okay, rural health, true, but now we're thinking like one step further, critical thinking. Who are the people that are in this net of rural healthcare? A lot of times it's indigenous communities. And now we start talking about, okay, here's what's going on with them. We have this $20 million fund, and these specific things tell the interviewer without you having to talk about your extracurriculars, because a lot of the times people want to force, hey, these are my extracurriculars, I've done this volunteering. No, simply by saying things like this, it shows you've been around, you've been to the hospitals, you've been part of clubs at your university and community organizations that address these vulnerable populations. Additionally, addressing the vaccine hesitancy as seen in the low vaccination rates in Alberta is crucial. Educational campaigns tailored to rural communities, emphasizing the benefits of vaccination and addressing misconceptions, can improve public health outcomes. Like, I don't know what else to say. Not only does this answer address everything in the question, but then it goes beyond, talks about indigenous communities, and even thinks even farther, extrapolating to vaccination rates and other public health ideas that are especially relevant to Alberta. So again, here are the strong points. We're demonstrating relevant knowledge of Alberta policies. We have a multifaceted way of addressing the topic, and we present innovative ideas. Now, if you look even further, maybe we could have said more things like suggesting partnerships with local educational institutions to provide hands-on training for medical students in rural settings. If you get medical students to go into rural settings, a lot of them might be like, hey, I like this. And you might have more practitioners now, more clinicians that are willing to go to those rural areas. You could encourage the use of local healthcare workers as liaisons to bridge the gap between healthcare providers and rural communities. You could promote research initiatives focused on rural healthcare challenges and solutions. So there's all these ideas you could use to not only address the question, but go beyond in the many ways I showed you to stand out, okay? We're going to do our last part of the presentation now. I mean, I promise you it'll be a short one. Are there any questions before I go to the next section? All right. So first impressions, for me, this is a huge one. I'm really big on confidence. So in the thinking period I'd have for my MMIs, panels, you can't really do this as much, but in that thinking period, I'd rehearse the first few words or maybe the first sentence I'd say, just so when the camera turns on, boom, it comes out of me like I'm the president or something, right? Or the prime minister. So always make sure you smile. Now, if it's a synchronous interview, I'd say, hello, my name is Kevin. With whom do I have the pleasure of speaking with? And I thought it was like a weird kind of introduction, but it's actually, looking back, a very mature introduction. You want to get their names. So you can say, you know, Dr. Locke. You can use their names, especially at the end. Thank you again, Dr. Locke, for taking time out of your Sunday evening for interviewing me today. So use their names and use that, and always introduce yourself to have that good first impression. Now, personal questions. A lot of the times in your MMIs, you could be asked personal questions, especially in your panels. Okay, and this could be in the form of even like a follow-up question you might get at the end of the MMI scenario. So you should look, and the way I approached preparing for this is I'd go through the CanMeds roles. Now, I actually use the American list, so it's right here. It's pretty similar, but I just like this one a little more. But you can use CanMeds. I'd have 2 to 3 stories ready for every single category. 2 to 3 stories for communication, 2 to 3 stories for problem solving, okay? Because you could be asked a question like, what is the biggest challenge that you have overcome? And I've been asked this maybe like 10 times. US, Canada, doesn't matter. And this would hit a lot of things. It would hit like overcoming conflict. It could hit resilience, capacity for improvement, maybe problem solving, maybe communication. So again, the same stories could be very versatile in nature too. And when you make your stories, the method I use to craft my stories is called the STAR method. So first you describe the situation, the task, the action, and then the result. Okay, now let's look at what this could look like. Last semester in the McMaster Biology Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. Boom, S&C out of the way. Now here's the thing, why do I want to get those out of the way? Because it's the A and the R where you get your points. It's the A and the R which show your skills, your problem-solving ability. Those CanMeds roles, that's where they get integrated in the A and the R section. It shows who you are and it conveys the kind of person, how you deal with things, okay? And here's the thing. The first time I was interviewing and I didn't get into any schools, I'd spend like half the time just talking about the situation, right? Oh, there was this professor and it was a Wednesday night and they had a meeting, they couldn't do this and blah, blah, blah. And it's easy to do that because these are stories that are personal to your life and you want to put your interviewer in in your shoes. You want to have them understand the amazing actions that you took and why it was such a difficult situation. You really want to convey that. But the thing is, it doesn't matter if you say, hey, I was in the prime minister's office curing cancer. You don't get points for the situation that you describe. It's the action and the results. So the quicker you can say this first part, it's going to work out for you, okay? So let's look. Consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approached the most promising ones to renegotiate terms suitable for our budget. I used strategies like calling suppliers instead of email to ensure rapid communication. Ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. Beautiful, mature answer, and addresses the question. Obviously, this isn't the biggest challenge someone's overcome, but it is a challenge nonetheless. Now, here's the thing. How can you go beyond? And I think the STAR method, which is a very popular method, it's missing a letter. It's missing a T. And I think I invented this, but if the START method exists, please let me know. The T stands for takeaway. And where possible, I'd always pick one of these two, either a personal story or a relation to my future profession to add to my personal stories, which helped me go above and beyond. So let's look. We're going to give the same answer, but look what we're going to add at the end. As I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills, along with my problem solving, I will continue to ensure team needs are met for the benefit of my future patients. And this is like, wow. This is so beautiful because it just shows, it exemplifies your maturity. Not only are you showing your CanMeds roles, right? You're showing the skills that you have and how you use them, but you show that you've reflected on your future career. You understand what it's like to be in medicine. All right, I'm going to be in rapidly changing situations. So this is a takeaway I would have for kind of like problem solving situations. And the beauty is I would have a takeaway for every single category of the CanMeds. If it was like collaboration, right? I would say, oh, as a future physician or as a medical student, I'm going to have to collaborate in multidisciplinary teams with people from all walks of life to provide team-based care, holistic care to my patients. And I need to be able to overcome conflicts and see people, at eye level. So I would have a takeaway. And the beauty is these takeaways for all these CanMeds roles, you can craft them before your interview. So anytime you're like, damn, I wish there was something else I could think of to say, I would have them ready. Boom, boom, boom. Okay, collaboration question, boom, collaboration takeaway. I'd always append it at the very end of my answer to get those like bonus points, right? It's like bonus points really. And you could reuse them since, with scenarios, you have different interviewers in MMI. And it's really phenomenal. So always make sure your stories reflect your values, your future career where possible, the CanMeds items, and the medical school. This is something that no one else is doing again. This is something that I learned from, I might have been the only person in the Canadian cycle last year who was doing this. I might have been. I learned this from the American system. In America, if you're an American citizen, which I wasn't, by the way, I was not. If you're a top applicant, you're going to apply to 30 schools. You're going to get interviews at 20 schools, and you're going to get accepted to 10 schools. So I don't mean to ruin your Sunday night, but that's the truth of how it is in the US. And because you're going to get accepted to so many schools, they want to ask you, well, why do you want to come to our school? And you got to have a convincing answer, okay? Why do you want to come to a school in New Hampshire when you live in Los Angeles, right? Now, in Canada, you're lucky to get a single interview. You're lucky to get a single acceptance. So they're not really asking that. Although I have been asked, why do you want to come here one time by a school in Canada. The thing is, the second time I interviewed, I would research the crap out of my school, right? I'd go on every single tab of the medical school that I was interviewing at, read about all their faculties, all their research departments, all their global health opportunities, where they rotate, their clinical rotation sites. And I'd be able to answer, like, if they asked me, for example, a question about antibiotic resistance, I'd say my answer, a very good, well-researched answer, and then I'd say, hey, I know that your school has one of the premier antimicrobial research laboratories focused on, I don't know, fifth generation cephalosporins, I don't know, some random thing. And as a medical student, I would love to contribute to that. And just by saying that, it's like, wow, this person researched our medical school. And it's not like, oh, they're just desperate to get in. This person understands what, hey, I want to come to your medical school. And automatically you start standing out against the leagues of other people who can't say anything. Do you know where the University of Alberta's clinical rotation sites are? No. But for example, if you're asked a question about rural healthcare, about Indigenous communities, you could say, hey, I know in fourth year I can go rotate at this site, that's like very, very distant and remote. And I would love to use that as an opportunity to improve my abilities to care for this specific patient population. Like, boom, once you start actually understanding how the medical school's curriculum is designed, where you can rotate, the global health opportunities they have, all these things, it's just going to come to you mid-interview like, oh, I remember they have something like this, and you're going to say it, and it's going to make you stand out like nothing else. Okay? Pro tips, I got some quick ones for you. Organization, so this is about letting your amazing answers get the recognition that they deserve. So in your first sentence or two, give an outline of what you're going to talk about. For me, this will usually look like, hello, I'm going to begin by addressing the pros and cons of implementing such a public health policy before giving my opinion, and then relating it to an experience I've had in the area. And just by saying that, a lot of people, they see the camera, they start talking, and then they're talking. Some cool idea comes up, then they go on a tangent. They forget the main point. They forget to answer the question. So just by having an organizing phrase, you already start standing out because you tell the person who's interviewing you how to follow your answer, which helps them really, pick up on the main points of what you're saying. And then look at this. I'm going to relate it to an experience I've had in the area. This is like, wow, it's like Christmas. Not only are you going to give them an answer, but you're going to give them a personal experience. So imagine your interviewer has heard the same basic answer, the same, copy-paste answer everybody's been saying 20 times for the same question because everybody's reading the same stuff. But now you're going to give them a personal experience. So they have something to look forward to at the end, something unique. And you, in my opinion, you're standing out before you even said your answer. Okay? Avoid extreme stances. Now, this sounds very logical, like, oh, Kevin, you don't even tell me this, right? Why are you telling me this? But it's more nuanced than you think. So for example, let's look at this question. Should pharmaceutical companies be allowed to provide gifts, such as free samples of their latest medicinal compounds to physicians? And I know 90% of people will be like, no, this is a terrible idea. It's a conflict of interest. No, conflict of interest. We can't do this. Pharmaceutical companies bad. Those are evil people, right? I know most people think like this. But imagine you were a little bit mature and you're like, well, let me spend 30 seconds thinking about how this could possibly be good. Okay. And then you realize, okay, well, in Alberta, we have Medicare, which means medicine, medical services are free at the point of service, but we don't have pharmacare. We don't have free drugs or prescriptions. When you go to get some antibiotics, I mean, you're paying for those guys yourself. It's either that or use your mom's insurance, your dad's, or maybe your own insurance, or maybe certain income brackets also get governmental assistance too. But the thing is, medications aren't free. So what if you have a patient who needs a certain compound, they can't afford it, but now this pharmaceutical company is giving it, a bunch of free samples to you. You have like 10 boxes. I've seen this be done. In fact, I've gotten one of these free samples from my own family doctor. And now you can give it to your patient for free. Maybe it's going to treat their chronic condition, or maybe it's a better treatment for something that they have. Maybe it's going to save their lives, right? So you never know. And this could really help in that sense. Also, what if it's a really good medication, a really good new compound that's going to help improve your patient's quality of life? And if there was a law that prohibited this, gift giving of free samples, now you can't discover it, right? Now your patients are going to not have a better therapy. Or what if this pharmaceutical company was a big part of the local economy, right? Maybe it's based out of somewhere in Alberta, and now because of this law, they're going to go bankrupt and they can't provide these medications anymore, which obviously help patients. I mean, medications exist for a reason. They help people, usually. And what if a lot of people are going to get laid off? They got families to feed. So there's a lot of repercussions that you can think about. And there, even if someone seems super evil, even if it is obviously conflict of interest, you can still spend some time discussing the nuances of the situation and approaching clear questions with balance. Okay, it doesn't mean you need to be, oh yeah, we should definitely do this. You can still have your opinion, and there's probably a right answer of this is a conflict of interest to a great extent. But if you can be the 1 person out of 10 who will be like, hey, there are some benefits to this actually. This isn't just evil corporations being evil. It will help you stand out above many others. Study at night. So when I was a teenager, I read this book called The 7 Habits of Highly Effective Teens. And it said what you do right before you sleep, 45 minutes before you sleep, gets replayed in your brain up to 6 times more than anything else you do that day. So right before I go to bed, I'd be practicing for my MMIs, for my panels. So the perspective-taking mindset would become my way of thinking more than something I'm just going to memorize for my interview day. Okay? So try not to watch the news at night. What's the news? Oh, this person got robbed, this person got murdered. You're going to have bad sleep, right? It's the same idea. If you watch a horror movie at night, you're going to have nightmares. So I do this at night. And also here's the resources I use to go to get perspectives other people didn't have. I listen to the Nature Biotechnology podcast, the MIT Tech Review, the Stanford Future of Everything podcast. I'd read the Financial Times. I'd read the Wall Street Journal. I'd be at the gym, listen to podcasts, or I'd read something on economics, technology, finance. And these really helped me have strong ideas beyond what everybody else was thinking. Oh, AI medicine, we need to worry about bias. True, that's correct. But what about other stuff? Like what about AI medicine applied to genomics, right? What about AI medicine applied to diagnosis and medical devices? What about cyber warfare? Last year, many healthcare systems across Canada were completely paralyzed with ransomware, right? They'd be like, send me like 10 Bitcoins and I'll unlock your, patient's data. So what if AI breaks encryption and now all our patient electronic health records are going to be out in the open? There's a lot of cool ideas you're going to get only by reading things like diverse viewpoints. And this isn't just for your interviews. I hope you know this. This is like for you as a human. So you're not some like robot that thinks the same things as everybody else. You understand, hey, this is the way the world is going. Zoom out. So sometimes it's relevant. If you have a small screen, you might want to zoom out on your on the interface so you can see the full question. And share videos of your answers with colleagues. So especially when it's a virtual interview, you can come into our website, thebrightdoctor.com. And these are our question banks for medicine. We have the medical school MMI interview question bank, both for traditional and MMIs. You can come here, right? There's over 100 questions. I can reset it. I have 98 left. And you can create a test with the same parameters. You can give yourself like 1 minute to read the question and 7 minutes to answer, or maybe practice answering in like 3 minutes. Create your test. Boom, boom, boom. What is your biggest regret? You're going to get asked a question. Describe a time you dealt with an unreasonable request from a supervisor. And there's a lot of questions. What are some healthcare problems facing Native populations? Then you can begin your response. You can talk to the camera. And this is what I would do. I'd film myself doing this, and there's 3 minutes left. I'm going to finish. And you can review your answer, save your video, and then again, look at those expert example answers, ideas to go beyond, and red flags to avoid. Okay, you can do this for our entire question bank, and I would review that. Am I talking too fast? Am I moving my hands too much? Am I looking at the camera? And again, practice, practice, practice. So there's a lot of topics you need to not only understand, but be able to provide expert opinions on. So we have question banks, mini question banks on a lot of topics like Alberta health policy, which you just saw. So 12 questions on that. I'm going to reset this. So you can go study mode and you'll see like, this is one we just did, the rural question. But what about how would you address the increasing mental health and substance abuse issues in Alberta, given the current health policies and resources, right? So we have specifically real-time, well-researched answers relevant to Alberta, relevant to Ontario, so you can look at other provinces. That's going to be very good for your answers. Opioid crisis, AI in healthcare, social determinants of health, American health policy. This is huge. So why is this huge? Because I did an exchange in the US, in Texas actually, and I studied US health policy while I was there. So imagine they're asking me like, okay, what should you do in Alberta about, this problem, right? Organ donation or whatever, or like abortion or anything, right? Anything. And you're not only do you give a great answer relevant to Alberta with the current state of thinking of Canada and Alberta, but you're like, you know what? Actually, we don't have to like really do some guesswork. This has already been implemented in these states in the US, right? Go study other countries. So for example, you could say, this is what they're doing at the Bismarck system in Germany. This is what they're doing in the NHS in the UK. This is what Singapore is doing, right? And once you understand other healthcare systems, it really makes your answers so much richer than other people who just provide these theoretical ideas and answers that they read online. You went and you're like, hey, we don't have to actually guess. We've seen this be done in other places in the world, and that's really going to set you apart. Telehealth, alternative medicine, malpractice, again, British Columbia, Manitoba, genetic testing, genome editing, CRISPR, vaccine ethics, mental health. And again, we have over 100 questions in our MMI question bank. Also, we'll be sending you a subscription credit for coming to our webinar. We're going to send this right after with the slides. And that's about it, y'all. Do you have any questions for me? That's the whole presentation.